I'm Tian, a student in the PhD program in epidemiology, Harvard School of Public Health. It's my great honor to introduce our moderator for the panel discussion, Dr. Stephen Gilman. Dr. Gilman is currently Chief of the Social and Behavioral Sciences Branch of the Division of Intramural Research Program of the Eunice Kennedy Shriver National Institute of Child Health and Human Development. He is also adjunct professor in the Department of Mental Health at Johns Hopkins Bloomberg School of Public Health. His research focuses on the emergence and persistence of inequalities in common mental disorders over the life course. His work demonstrates the importance of childhood environment for neurodevelopment and subsequent onset and recurrence of psychiatric illness in adults. Please welcome Dr. Stephen Gilman.
Thank you very much. So let me ask Peter and Kathleen to come up to the podium and
Because Wanda's going to answer all the questions.
right. I'll just be one of many to say what an honor it is to be here today at this really wonderful event. One of the wonderful aspects of a symposium like today's is that those of us that know Dr. McCormick in one of her many roles get to appreciate how many other roles she has filled and what a tremendous impact she has made in all of them. So therefore, before opening up to general discussion, I would like to synthesize what we have learned in this afternoon's panel, what we have learned about Marie, and then offer a closing thought. So we know Marie as a scientist, leader, advocate, collaborator, mentor, and healer. As a scientist, one of her driving passions has been to understand why some children are born too early or too small, how to care for them if they are, and how to ensure their lifelong well-being. Oh, it's a different part of the PDF, I'll tell you what it is. As a leader, she mounted landmark studies such as the Infant Health and Development Program. And the top one is meant to be the title of the original JAMA article, IHDP. So many of us first had the opportunity to explore the study by downloading the data set. That was really easy. But we recognize, of course, that IHDP took strength and commitment of leaders like Marie to generate excitement and funding for the study, establish trust with participants, and maintain the study across decades. IHDP inspired the field because it proved that early interventions could be done and could improve lives. Marie was also called on as a leader in different circumstances, such as the largest, most important, and expensive study of child development that never happened. She helped us understand why and where to go next. As an advocate, she took on the challenge of the difficult and controversial. The top article is from Vaccines and Autism, from the commentary on that report. She explained in that commentary that dealing with the crisis of vaccines and their fake news reports linking to autism will require much more than science, but effectively communicating with families in the context of floods of information from unverifiable sources. In 2007, she reflected on what it will take to reduce prematurity. Let me read you a bit from that reflection. We were on the first Institute of Medicine panel that addressed the issues related to premature birth in a report issued in 1985, Preventing Low Birth Weight. On the one hand, much has been learned about potential risk factors and the biological pathways resulting in preterm delivery. On the other, racial and socioeconomic disparities persist, and we still cannot prevent or reduce the rates of prematurity. This report makes a specific organization recommendation to facilitate the need of research so that we will not be in the same position 20 years from now. and we're midway through that prediction. As a collaborator and a colleague, the large cloud speaks for itself and how valued she is. And these are only the first authors of the publications that she has collaborated on. Marie's passion for mentoring and teaching is evidenced by the filled seats here. She has mentored students, and their students. And the passion is what we saw as being on the receiving end of the mentorship. But underlying it, we know, is a tremendous investment of effort. The years I worked down the hall from Marie, I knew quite well when it was time to submit that training grant yet again, and how much work went into that. Those of us on the academic side don't always have a chance to directly witness the clinical contributions to patients' lives. Her clinical work has been essential to informing her scientific contributions. And as a former premature infant, myself, we are grateful for Marie's work at the individual level as well as the population level. So, Marie has a unique ability to tell it like it is. In this commentary on a study purporting to develop a new measure of neonatal risk, she reminded us that some challenges seem intractable, and solving them requires a fair degree of courage. The last sentence of this commentary says, "The authors have taken a first step on a long and arduous road of inquiry. Perhaps they will have the courage to continue." I think her words apply much more broadly than this one study. And courage is what we'll need. It's what we still need in the face of recent increases in rates of prematurity and stark disparities in them. So what Marie has established through her impacts in science, leadership, mentoring, advocacy, and clinical practice set the stage for the future of MCH. And so I think today's symposium is better titled, "The Future of Maternal and Child Health, Children, Youth, and Families." And let me just leave you with one, for the trainees, let me leave you with one thought that I think Marie would tell you, and maybe she will after this, which is get to work. So with that, I want to thank the speakers today and open it up for general discussion. And I would like to ask Kathleen a question. What was the secret sauce? What is the recipe for getting a room filled with people who think they're very important to do what you want them to do and to come and to produce a good product at the end?
Well, we often say it's an art and not a science, so maybe sauce is the right word for it. It starts at the top, and that means it starts with the people who've chaired the groups of committees, and that's where Marie, came in. It really comes from somebody who knows how to cajole, who knows how to lead, who knows how to analyze, who knows how to ask the right questions, who knows how to just lead. So the answer is Marie, and there's people that the academies we go back to time and time again, to help lead our most difficult topics, and Marie was one of them, and it's because of that ability.
I think you're asking a sort of a broader question too, which is how can we accomplish more with people who are diverse and have potentially different opinions? And I actually think one of the keys to success is for the leader to ensure that it's not about the leader, that it's about the goals and the mission. If you can do that, you can, and if you have some energy and a little bit of EI, emotional intelligence, you can bring a group of very diverse people together. And let me give you one of my own examples. So I sit on this panel called MACPAC, which it's Medicaid and Chip Cost and Access Commission. So we advise Congress and HHS on Medicaid and CHIP. And it's a very diverse group of 15 voting commissioners, conservative, liberal, and we had a major vote and discussions last year on what to do about CHIP, about reauthorizing CHIP. So I'd done some research on CHIP, so I could wear a sort of a research hat and an evidence hat. But what I really tried to do on that committee, which was completely split and heading toward potentially not recommending CHIP strongly, because the evidence for health insurance for children is not as strong as for some other things, is to talk about some principles. That is it right for children, if you take away a national program, is it right for children who grow up in Alabama to have different opportunities in terms of health insurance than children who are in New York or in Massachusetts? Is it right that children are punished in some ways because of some decisions, that whether either the decisions by parents or decisions by institutions? We converged on a set of principles that people from very different perspectives agreed on, and ended up recommending a 5-year renewal with full funding of CHIP, and Congress ended up passing that, and for bizarre reasons, good reason, it ended up being a 10-year renewal because of weird stuff. But as some people in the audience know, but that was an example where, so I was viewed as the pediatric, the CHIP person, but it wasn't about me. It really was, the focus was about children.
I want to ask Peter a question, and while I'm doing that, I want a trainee to come up to the microphone and take advantage of this panel. So from the perspective of the trainees, just imagine I'm one. So how can I be a better mentee?
Can we take it? There's an incredible book on mentorship if you want it. It's called On Being a Mentor. It's written, I can't remember the guy's name. He's in the military. Does anybody know the name of this author? But it's not just about on being a mentor. It's also about being a good mentee. So some things that proteges should do is be prepared. So I do ask my proteges when they come in to have an agenda. I kind of have an agenda for the year, but not for each meeting. So having an agenda is, I think, sort of really important. Find your balance between not wanting to ask for too much help, but not being too macho. Sort of find your right balance. Recognize the imposter syndrome that many of us, including me, have, that you feel like you don't really belong. If your mentor believes in you, then you do belong. Then you might be able to be successful. Push your mentor and give some feedback to your mentor. It's really hard because of the power stuff, but you can, you know how to use the word I could use this. I could, so give some critical feedback to the mentor, and watch your mentor and watch your other people. So role model, you're not going to become a clone. I don't think Marie's created any clones, but I think you've all taken aspects of what she is, as well as some of your other mentors and advisors, and tried to roll that into who you are. So maybe the common theme is to be a real active protege and not to be a passive protege. And maybe my final thought is try to live up to your mentor's expectations, because I bet the expectations with good mentors are really, really, really high, and that will serve you well during those low times. And in academics, there's many of those. So try to live up to your mentor's expectations. If they didn't have high expectations, they wouldn't be your mentor.
I have three slightly more practical pieces of advice. Just as in response to the last question, Peter said that a leader knows that it's not about you. To the mentees, the feedback, and sometimes strong feedback, is not personal. It's really not personal. It's about developing you. I would say to be brave and overcome your fears. And to know that there are a lot of paths to where you're going to end up, and that none of them are wrong, and many of them will get you there.
What is that? That means we're done? Oh, okay. Well, I want.
They're lucky it's
I'm told we're
almost
turning
over.
over to the next the next section, so I want to thank our speakers and thank you all for participating.